Dr. Malone, Joe Zarzaur here with another COVID update. We're July 22nd, is that right? July 22nd today?
Yep.
And we are in what would be March, April, May, June, July. What is that? 4 or 5 months of dealing with remote work. We had a little brief respite where we came into the office with a skeleton crew until one or two of the crew members got suspected of having COVID, and we had to pull back on that. One of those crew members actually did end up with COVID. Fortunately, she had 4 or 5 days of symptoms and recovered. She got it from her roommates, and fortunately, we were exercising physical distance and masking in the office, and it wasn't spread anywhere, thankfully. So that was what, 3 weeks ago now, 4 weeks ago now, and we have been remote ever since. This crew that's been in the office, we've created a lot of distance within the upstairs and downstairs of the office, and we've also been masked if we're moving around from our desk. What we've relied on you, Dr. Malone, to help provide us in the office and through these videos, provide the local community with data that justifies changing our behavior and paying attention to certain things from a health standpoint that we otherwise might not pay attention to. So I asked you a couple of days ago to pull some information for us to share with the public, and was wanting to know if you had any new information on locally what's going on with our numbers.
Yeah, absolutely. So this is probably the most useful, oops, let's see here. This is probably the most useful document that I think I showed you today that kind of depicts a little bit of what you just described, where we as an office left and then came back, and it's right here. It's the percent positivity as far as the testing.
All right, and, now, first of all, explain what that means, percent positive, because people hear different things in the news and they think, oh, that didn't mean anything. There's more testing, therefore their bid numbers are higher. So blah, 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 right?
Yeah.
So tell us why percent positive matters.
Okay, so these are weekly pings on this list here, so it's not showing every single day to that granular of detail. But the easiest way to think about it is if you did 100 tests on April 1st, then 9 of them came back as being positive. So that's a 9% positivity. And so then you extrapolate accordingly. So if it was 1,000 tests, then you'd be looking at 90 positive results. Okay, so it goes up with the amount of tests, or scales up or down rather.
And so I guess some people argue, well, that's just because more people that are sick are getting tested. What do you say to that?
Yes and no, because I think that you and I will both agree, just anecdotally, that a lot of people were getting tested that weren't sick. It was it was the thing to do because that was what we had in our control. Like, hey, we have to get tested because we might have had an exposure. And so, there's plenty of people going through there that were asymptomatic and were getting the test and weren't really expecting a positive result. And then all of a sudden, like, oh, wow, I was positive.
I remember the day that it was below 1%. When was that? I remember looking at the figures, because you send me the figures every day.
Yeah.
And I remember the day it was below 1%. And I'm thinking, damn, below 1%, this is a non-concern. Why is anybody even concerned about this?
And what you're speaking about is the part of May there, and I don't know if you can see that on there, but probably around May 7th or so, we're at 0.8%, and we were down there for more than just one day. It was for a series of days. Again, this is a weekly average that they're showing on here, just to kind of even it out and show you the trend. But we were below 1% for quite a while. And,
and I think the thing that you take from this, at least I take from this, is there's more virus in the community, folks. And so that's what this tells you. Now, whether these numbers can give you an accurate picture of exactly how much is in the community, I don't know. And maybe you can argue about the numbers, but there's more virus in the community now than there ever has been. And we are, I guess, sort of flattening off a bit. I don't know if you could call that a downturn, but we're certainly at a little plateau. And the question is going to become whether we go up or down. And in large part, that is going to be a reflection of how well we're masking and distancing. Is that fair?
Yeah, yeah, exactly. And I'll show you on here real quick. That was the county, and then it's reflective of what we have. If you look at the state trend, again, this isn't as pretty of a straight line, but this is the positivity, again, statewide. So if you look back in mid-April, we're 8 to 10%. Floating around there, and then around the first part of May, the statewide, now this counts all the counties, it dipped down to its low of between 2 and 4%, depending on the day you looked, and then started scooping back up there toward the end of May. And so that's somewhat reflective of what we had in the county here. Again, we got different parts of the state with much different numbers, much different testing levels, be it higher or lower. So just take this that we really, the same shape is there for each county. I think it's just that maybe the magnitude is different.
How does our percent positive, which is somewhere at 13% or so, how does that compare to like Jacksonville or Orlando or some of those other Florida cities?
Yeah, so I'll show you that real quick here, and we're going to share this link tonight, as we always do. And this is the state report that's generated every day. And oops, not the state one, I'm sorry. Let's do the county one. So the county report that's generated every day, where you can kind of go through and say, you know, hey, where does our county score? Which is exactly what you're asking right now. So here's the state of Florida. Oops, yeah, so here's the state of Florida, right, statewide. And this is where we're at for the last couple of days, right? 14.75%, 13.6%, 10.55% statewide, right? So then you can say, what's going on in my county? And so it's alphabetical. So here's Alachua. This is where Gainesville is, right? Big university, right? Look at their numbers. Don't you wish we had that?
What's their percent positive? I can't see it from here. My glasses are not.
So the percent positive is they're
5.6.
Yeah.
Well, the kids are not at school either, so.
No, they're not. But I have some family members who were just there within the last week, and I was told that it's county-wide masking ordinance is in place, and it's pretty strict as far as going into stores and all that. Like, meaning they saw people getting kicked out that didn't have masks on.
Wow.
So there's something to be said about that.
All right, but what about like Jacksonville, which is Duval County?
All right, yeah, let me get over that. Sorry. Well, here's we'll go to date and then Duval.
All right. And is there a listing somewhere that ranks the counties by percent positive in Florida?
Sorry about that. Am I on here now?
Yeah.
Okay, sorry, I dropped out there for a second. Apologies. Let me share this content again. Well, I'll pull it up on my end. It looks like the screen sharing.
My question was, is there somewhere where the counties are ranked by percent positive?
Not that I was able to find today, and that's where I looked high and low, and this is the closest where I could find.
So you basically have to look one by one at each county to see what their percent positive is?
Yeah, I didn't see a county side-by-side comparison that was immediately available.
How does Escambia County compare to like, I don't know, Duval County?
Yeah, so if I can, I'm going to try and share this without getting us dropped off this time. This is
how about not even worry about sharing it? Just pull it up and tell me.
Yeah, sure. Yeah, sure. I can do that.
Right.
So statewide here, we have, let's see here. I have the county data comparison. Here's the, so let's see here. It doesn't have the percent positivity, but like Dade County's got 24% of all the cases in the state, and they're number one. And Escambia County is 13th in the state with of the amount of cases.
All right.
We're 13th. We're 13th place.
I was curious to know if there's a way to compare percent positive to the different places in the state. I'm surprised they don't rank that, because that's really the only figure I look at every morning when you send me this stuff is percent positive.
Yeah,
because I want to know whether our percent positive is going up or down, since that's the way you measure how much infection's in the community.
Yeah, let me show you this, and I don't think it should drop out. Here you go, Joe. This is what you're looking for.
What's that?
This is.
Okay, yeah, that's it. All right, now, so where are we? We're like number
like I think 13th.
13.
And so we're not 13th by percentage, we're 13th by the total positives. And so 13th in positives, we're at 11% positivity rate. And, you know, two places in front of us, Manatee, they're at 10%. So they have more cases than us, but their positivity is just a tick lower.
But our percent positive was 13 today. Is that an average they're taking, that percent positive?
Yeah. Yeah. This is the average from day one.
I don't think that's a good way to look at this, though. I think in order to get a snapshot of what's happening in your community, infection-wise, you should be looking at like real time, what's going on with your percent positive, right? So right now it's 13%. What's the date of that chart?
This was released today.
Okay, but our percent positive was 13, right?
Correct, but our overall positive since day one, when you do the math divided over time, it's 11%.
Okay. I don't see why that's even relevant. Who cares what it was in March at this point, you know, because it dipped and now we're on the rise. And so I'd want to know in the last 2 weeks or month, what's the average percent positive for various places. Escambia is 13. If you just take that chart you're looking at right there and you move it up 13, that takes us, it jumps us way up in the mix there.
Mm-hmm.
So, and on average.
Yeah, and that's available to view. When I tried to share it on here, that's when I crashed out. So I'm not going to do that again. But we are going to we'll link the county report, and so each county is listed in there alphabetically, and they show you. I'll share with you what we have for Escambia, and they have it for every single county. It's not side by side. And I understand what you're saying, and I get how that would be more useful to be able to compare ourselves to each other respective county. Right. Maybe someone has that somewhere, but the state doesn't publish that way. This is what's available for Escambia County. This is our day-by-day trend. So you're saying, you know, so today was 13.6, yesterday was 12.6. And so we were below 10% one day. It was 4 days ago, one day in the last 2 weeks. Yep. So yeah, then to say, hey, I want to compare Escambia directly with Dade, the state doesn't have that tool. It doesn't exist as far as I was able to find, besides going and taking a snapshot of this and then going and taking a snapshot of Dade and putting it right next to yours or whatever the county you elect.
Might should do that.
But I will share this because part of the exercise that Joe asked me to kind of go through and look at some of our trends is I went through, and this forced me to go back to all of I had handwritten scribbled notes from March. And I went back and there's some gaps in here because my notes were ruined. But anyhow, this shows you, if you just track like the deaths and all that kind of stuff and the total positives as we went down over time, and our percent positivity, you know, here in April is like 1.7 or 1.7%, 7%, 3%, depending on the day, as we marched along. But kind of just looking back historically, you know, by the end of April, we had, 470 tests positive, right? We had one day just 2 weeks ago that had 470 tests positive, right? Wow. Just one day. So it just kind of puts this in perspective. And I tracked, the deaths as they started, adding up over time. And then you can see where the state started to publish the median age down here of age 50 started in June 5th, and then it quickly plummeted down to the 20s and 30s. They started to publish that data for people to see. And here we are up to present. So I started listing the available hospital beds that were roughly 350 to 400, and then the available ICU beds, which is between 4 and 10, and the available ventilators, which is 130 to 150, depending on the day. So,
where are we now with ICU beds here locally?
There's right down here, it's the bottom thing. I checked right before we came on. We have 9 available adult ICU beds out of the 120 that are listed as, in the total pool for the county. Wow. So there's 9 available, which I guess, what is that, like 7 or 8% that we have left? And 63 deaths as of, I guess, when we came on the air here. So I've had an opportunity to keep more closer track here now that we've gotten some more data from the state. So I'm trying to do this just for my own historical, scientific geek kind of purposes, but for this also purpose to share it with people to kind of say, hey, we've been living in the greater than 10% range for, the whole month of July at least and into June. Yep. And that kind of aligns when we return back to working from home, as you mentioned at the outset here.
So, and Dr. Malone, that's a good example of how much effort you put into your work here. I mean, most of it's dealing with clients, and when we're reviewing medical malpractice cases or even a car wreck case with a serious injury, we have a full-time medical doctor on staff that's able to sift through all the medical stuff and sort of tell us what we need to know for purposes of the case. That's a good example of that with that summary. What other things do you have for us on the COVID front today to share with the folks watching?
Sure. So I think I mentioned this to you. So with our staff, Joe's been pretty involved with, trying to figure out the best way for people to kind of.
My frustration since day one is, look, I'm a business owner at the end of the day. If you're in my government, I want you to keep me running, okay? And how best to do that on day one, I said, get me a test I can give the people at the front door that gives me a result, right?
Yep.
And I got a test I can do at the front door, but we still have to wait 24 to 36 hours. But go ahead, Evan.
Yeah. So having the one employee that we mentioned that it was positive, now we're getting to the point of saying, hey, when is it safe to return to I guess as close to normal as possible, provided distancing and all that. And so the CDC recently changed this over the course of this last weekend, the criteria for coming out of an infection, where it was 72 hours of being symptom-free. They've changed it to 24 hours without a fever at the end of your 10 days without being on like Advil or Tylenol to reduce your symptoms. So 24 hours and then improvement of respiratory symptoms. So we'll share that today, but this is basically what it is the symptom-based strategy for someone who was infected is 10 days since your first onset of symptoms, and then you could have 7 miserable days in there. And then as you get to the end, you need to have 24 hours of symptom-free, no fever, and improvement of respiratory symptoms. At that point, they're advising that you can go back into the community or your workplace or whatever, again, provided you're continuing to mask and isolate and distance and use hand sanitizer and all that.
Re-exposed, for instance.
Yeah.
We had somebody on staff that had a roommate that was that had the virus, and then of course the other roommates got the virus later, and they were around each other the whole time. And so somebody's day one starts on, let's say, July 1st, and then they're around the person on July the 3rd that has the virus now. So their 10 days needs to start over again. So you've got to be careful that you honor that, because just because you have the virus doesn't mean you can't get it again and carry it to somebody else. So,
yep.
Because it's still 14 days, right, for people that are exposed to the virus?
Yes. If you've had an intimate exposure, close exposure to someone who is known to be positive.
Hold on just a minute. Intimate, as in, what are you talking about?
I guess intimate, I mean, if you were sharing a workspace with, if you were sharing a workspace with someone, if you live with someone, sharing a bathroom, things like that. So not intimate, I guess physically. Yeah. Right. So I guess I could reword it and say in close proximity for an extended period of time.
So if you're in close proximity to somebody that has the virus, the CDC still thinks that you should isolate for 14 days.
Yes, for 14 days from when you were in contact with that person. So if you continue to be in contact with that person, your 14-day clock or stopwatch hasn't even started. So if you continue to live with someone, your 14 days really doesn't start until they're basically done with their 10. So you have to remove yourself from one another, and then you can start the stopwatch on your 14 days. So that still is the same because they're finding that the incubation period for some of the cases that are coming out is, 3 to 5 days, but theirs can be as long as like up to 10 days. And by the time you figure that out, you're like, oh, dang, I didn't even know. And I've been going back to work and I thought I was in the clear, and you're not. So they're still advising 14 days. And then I'll show you guys just a couple other graphics on here. This is from the COVID tracking project that the Atlantic has. And this goes back all the way nationwide now, US, goes all the way back to March 2nd, when in the United States we had 0 cases. And then we had at one point 2 cases in the entire country that were known. So it kind of puts it in perspective, the amount of cases, and those are 10,000 number increments on the left axis there. So it's out there. And then let's see here, what else was also kind of impressive to me was right here. This is the hospitalization for the United States. So we had a dip there toward the end of May, and then as numbers started going up around the country, Florida included, so did some of the hospitalizations, which that to me was, when we were talking back then, that was the concerning thing to me, besides, yeah, the numbers are getting bad, but you really don't want to see the hospitalizations going up, and that's happened in our county, which is kind of unnerving.
If you want to look at this graph and sort of like step back, when it crested last time, look at it as a wave. It only was really cresting because of New York and New Jersey and that area, right? I mean, that's pretty much the first. We didn't have many cases at all down here,
and we didn't have many hospitalizations either.
Right. So if you extrapolate and you say, okay, geographically, we're now going to include the entire Southeast region and Southwest region and part of California in the new wave, that new wave is going to be a lot bigger, I would think, than the first wave, since the first wave geographically only included really 1 or 2 states.
Yeah.
So I'm a little concerned that this second wave dipped down. The second wave, I call it a second wave, is really part of the first wave of the virus, but the second cresting of the first wave of the virus, it involves a lot more geographic space, and I would think population-wise, a lot more people. And unless there's, and New York had tight regulations, so they got that to go down because New York's governor was like militant. You remember him on TV every day?
Oh yeah.
Okay. Well, I don't think any other governor in any other part of the country has been that on top of things, and that's how they got their numbers to go down. Otherwise, I think we'd have one big wave straight across. If it wasn't for New York's efforts to get it to go down drastically, we would just have one big wave across, and it would have come to the south, and we'd just be going straight across. Somebody's got to take some drastic measures at some level to get this to start going down again, in my opinion.
Yeah. So it's things like that. When you look at it, when you step back, when you step back and look at it that way, I guess it's one way to slice it and dice it. And I guess it makes sense to me. So then the last thing I was going to show you is this is the part that I guess I'm intrigued the most with as far as just medical is, and I've brought it up before, like the importance of the respiratory symptoms, because that's really what I think is what people need to be aware of. Is you can have the virus and you can be a healthy 24-year-old. The moment you start having respiratory symptoms, that's when you can't sit there and be too stoic and I don't want to go to the ER kind of stuff. So they are continuing to drive this point home with physicians and put this information out there to educate physicians on the assessment of adults who have asthma who also have potential exposure. And so this is for a physician. This is a 10-minute consultation teaching point for clinicians in practice. And this is what they're saying. If a patient's got pre-existing asthma, you have to perform a thorough history and help distinguish whether this is just straight up asthma exacerbation or if they have COVID and how you'd manage it. And you don't have to do it in person. They're saying that you can do this virtually as well to try and discern what the next step is. Like, hey, yeah, you do need to come in and we're going to take all the measures to get you to come in and not expose everybody. And, you know, should we be using steroids sooner than later if we suspect asthma plus the COVID? So it's educating the physicians just as much as I think the public should be educated about not ignoring the respiratory symptoms, because those are where you find, you know, wow, like someone younger than we thought who shouldn't have been hospitalized or even died from this, you know, didn't really listen to their symptoms. They're coughing their head off and didn't go to the ER and didn't listen to anybody. And, you know, maybe the outcome could have been different if they would have gone, kind of stuff. So if they're teaching doctors about this, the public needs to be just as aware. So That's the take-home point there.
And the importance of getting to the hospital faster is that they now have some drugs that lessen the effects of the cytokine storm that we talked about earlier in these videos, right? That really is the cascading effect of this disease process that really kills people. It's not the disease itself, it's the cascading effect that happens from the body's reaction to the infection, correct?
Yes, that, and then also, you know, you can be hypoxic like 86, 87%. And if you're young and healthy, you can actually tolerate it fairly well. But on a organ level, the lungs and the rest of the organs are suffering, and you're not going to know it until it's like beyond help. So to get in there and get triaged, to get some data points and say, wow, okay, your pulse ox is actually good, you're tolerating this well, you can go home. And that's like, I think locally there's a pulmonary clinic that was set up with Sacred Heart where they're telling people that are positive, call us or come to this pulmonary clinic if you think you have respiratory symptoms, and then we'll triage you appropriately. And it may be a waste of your time because we're going to send you right back home, but it's not as much a waste of time as going and waiting at the ER because they're feeling nothing but respiratory stuff.
No doubt.
And they're hopefully getting these people treated quick, in and out, back home, and then call us with close follow-up, and then we'll decide from there if you need to get more treatment.
All right. What else?
So then the other thing I had on here was, let me get this pulled up here just a second. This is, one other trend thing I had. Let me pull this up. Morbid, but we just got done looking at numbers going up. This is again US-wide, the COVID tracking project. So the death rate per, just the amount of deaths per day did peak, and we haven't seen that spike, the concordant spike with the hospitalizations or numbers, which I guess that's reassuring, but it's not a reason to not try and still attack this thing and be vigilant. But it goes to show you that I think it backs up what you said, where, there are some drugs that can help treat some of these when people are being hospitalized. So hopefully the people that are being hospitalized are making it to discharge and home, and not a discharge and to a funeral home. So
it's important to note, in my opinion, that if you look at that graph starting on, looks like July the 6th, there is pretty much a straight line going up to present day. So it is not leveled off. It has not plateaued. And my concern is that it's going to look a lot like the hospitalization, dual crest that we had both in positive cases and the hospitalization. Maybe a little less severe because of the treatment modalities we have now. All right.
Let me share one more thing. This is a bit more of good news, and we talked about this way back in March and April. These ACE inhibitors, and oh my gosh, everybody's worried because they're thinking that all these drugs are going to make it worse. Well, here you go. Here's the outcome. In a retrospective study where they followed people who had and did not have the disease, the conclusion is that prior use of ACE inhibitors and ARBs, which are the blood pressure drugs, do not have any kind of significant association with any worsening of their mortality or the way that they tolerate the infection. So keep taking your blood pressure pills, folks.
Yeah, that's another thing I keep hearing over and over again, and I think this is really important. I mean, don't miss your screenings for cancer. Don't miss your checkups with your physicians. You're more likely, I think, to die from those other disorders that you're going untreated for than you are from COVID. And so make sure that if you have pre-existing underlying comorbidities or illnesses that you have a regular doctor visit, don't miss that doctor visit because you have COVID or because you're working remotely or whatever it is, right? Because if you just look at the numbers, you're more likely to die from those other things than you are COVID anyway. And if you miss a screening for cancer or something like that, there's probably going to be a spike in those deaths later on from not getting the treatment that you need. So make sure you keep your doctor visits.
Yep. And you'd be amazed that there's people out there that, I always have a negative study or a negative screening and they never do anything about it. Well, Joe and I will tell you that there's plenty of instances that we're aware of because we see this with the charts that come through the firm, unfortunately, where, there's screening tests that do their job and catch these things. And, maybe there's, a reason that you don't want to be the one that missed it.
Right.
So
keep on. Monday, I think we're going to have somebody come into the office Monday that's going to do testing on all the staff on a staggered basis. So not everybody's here at the same time. We're going to put them in a holding area, let them get tested, and they're going to go back to their house. And then we're hopefully going to have results within 24 or 36 hours. And those that test negative are going to, everybody's going to remain somewhat isolated or as isolated as they've been throughout this process. And then everybody that tests negative is going to come back into the office, hopefully, and work masked and distanced work. Of course, people positive will not. High-risk people are not coming in at all even to do the test. So long and short of it is we're going to try to get a couple of people back in the office, hopefully with the test next week, and we may have to start doing it on a bi-weekly or weekly basis just to get through this process and, you know, keep the business running as efficiently as possible. And it runs great remotely, but it's not as great as it could be here at the office. So we're very busy. We've actually busier than we've ever been, which is great. But at the same time, we are being very, very careful, and it poses logistical challenges to getting things done sometimes, but we get them done. It takes longer, maybe. It's a little more cumbersome being online and virtual than it is in person, but we get them done. If you have a question for Dr. Malone about COVID, or if you have questions for me about any injury case, you can find us on the web at zarzaurlaw.com, or you can call us at 855-HIRE-JOE. We'll be here to answer those questions, and obviously we're still seeing clients virtually. Hopefully you won't be one of those people we need to talk to for that reason, but if you are, we're here for you. Y'all take care and be safe. Thank you.
Yep, I know.